Goodbye.
Thank you very much, Grandma Germaine. And if you're just joining us, this is Family Health, and we are live on 88.4 Real FM. The Listeners Radio, we are discussing hypertension and diabetes in children. Earlier on, Dr. Misanga Dimitri was talking to us on how to prevent hypertension in children. Let's talk a little bit about hypertension diabetes in children. Is there a way we can prevent it at all? Well, type 1 probably not, but type 2?
Type 2, yes. The good news is that the same measures that apply.
Okay, no vaccine. Okay.
There's no vaccine. The good news is that the same measures that apply to hypertension are the same measures that apply to diabetes.
Really?
You know, in our common mindset, people always think that diabetes goes hand in hand with
they
hypertension.
Are twins, evil twins.
That's it. So basically, the same measures apply to diabetes. So it's a matter of lifestyle changes.
Okay.
But before going further, I want to precise that prevention is manifold. So prevention has different levels. There's what we call primary prevention, where we seek to prevent the occurrence of the disease.
Yeah.
And we have secondary prevention, where we seek to prevent the coming in of complications.
All right.
So what is most important here is preventing the disease from getting in, and that's what we do when we apply the lifestyle changes. So amongst these lifestyle changes, we have things like reducing the sugar we take every day, the sugar intake, doing physical exercise regularly,
okay,
drinking much water, and avoiding a sedentary lifestyle.
Wow.
So basically, these are the different ways in which one can prevent diabetes.
That's why we call them twins. Diabetes and hypertension, they have basically the same.
Actually, and one of the common risk factor for both hypertension and diabetes is overweight. So people who are overweight are predisposed to diabetes. So they too, as a lifestyle measure, have to lose weight.
Okay. Which interesting for both hypertension and diabetes.
Yes.
And so parents, it's true we want to feed our children to go bulky, to reflect our wealth, but also understand that making this child overweight is exposing the child to health problems, hypertension, diabetes, and it's not witchcraft. It was not thrown on the child by some aunts and uncles in the village, but of course it's just the lifestyle. They sport the child is moving all inside the house, watching TV, playing PlayStation, all kind of game on the iPad. That's what basically how children live these days, and parents feel that it is to their advantage. It is to their disadvantage. So yes, now we need to discuss the complications that can result from poorly treated or not treated hypertension and diabetes. Let's begin with hypertension.
Okay, so the complications that can result from hypertension in children, of course, can either be acute or chronic. Acute here means in the short term, and chronic here means in the long term or in the long run. So in the short term, there are no much complications. The most frequent complication is what we call hypertensive emergency, which is a situation whereby there is a drastic and brutal rise in the blood pressure in the child. This can be due to many things. For instance, let's say he does not take his drugs correctly, or he does not respect the lifestyle changes. These things can contribute to drastically or brutally increase the blood pressure in children.
Wow.
Now, what we need to know is that when such a thing happens, there is a repercussion on what we call target organs, because hypertension is going to affect many organs in the body, and the four main or the most important organs affected usually by hypertension are the eye. So you see someone who has a brutal increase in the blood pressure and starts complaining of blurred vision.
Hola.
Second thing can be the heart. So hypertension has a repercussion on the heart, and in the short term can aggravate a heart defect or a heart insufficiency or a heart deficiency. The next organ sorry, the next organ is the brain. Earlier on we talked about stroke. So hypertension is at the origin of stroke in children. So when there is such a brutal increase, either the blood vessel is going to be lacerated, that is going to tear, and blood is going to ooze out into the brain. That's the most common mechanism. Or due to certain other complex factors that are associated with hypertension, like increase in blood lipid level, you can have a situation where the blood vessels in the brain are obstructed. So that's ischemic stroke. And the last organ that has a repercussion is the kidney. So in the short term, you can have acute kidney injury, or what we call in French insuffisance rénale aiguë. Now in the long run, hypertension is still going to have a repercussion on these same organs. So the chronic complications are same or concern the same organs in the acute complication. So in the long run, these organs are going to be irreversibly damaged. So the kidneys, you have someone who had hypertension early in his life, and then by 40, 50 is in dialysis because he has chronic kidney disease. Same thing for the heart, same thing for the brain, and same thing for the eye.
And you know that when people start having blurred vision, the very first place want to run to is to the ophthalmologist instead of thinking that it could be something else. But that's when you neglect it. It has gone untreated for a very long time, and we have to. I really hope that people start paying attention to your health. Listen to your body. Someone once said that your body sends signals that you need to listen to them, and if you listen to your body attentively, you will not miss out on the signal, and you respond to the body's distress call, and things will. There'll be fewer people who are being hospitalized, and you have less work also, because you don't have to be doing a lot of rounds in the morning when you get to the hospital. This is Family Health. We'll take a short musical break again. When we come back, it'll be time for us to part company. But before we part company, we'll still have some small few tips to tell you, like maybe treatments for hypertension and diabetes. If I thought they have treatments, we'll discuss that also when we come back. Just time for us to breathe a little bit with this. Salomon, si vous chantez là, ça sera comme si j'ai mis le pape à côté. If you're joining us now, you are at the end of Family Health. I want to thank Dr. Dimitri. Before you go, is there treatment for hypertension or diabetes? Do we have treatment or just lifetime medication, or you can?
Actually, there are treatments for both diseases, hypertension and diabetes. So they exist.
It does?
Yes.
Treatment and cure, or just treatment?
They are chronic diseases, and in the common mindset, we know we're not cured from the diseases. We just manage them so that we don't reach the stage of complications. So there are treatments that are there to control the situation, to permit you have at least a decent lifestyle or a decent life.
All right. It's lifelong?
It's lifelong, actually.
Oh, parents, that's why we shouldn't allow our children to have hypertension or diabetes. Imagine a child start taking drugs from childhood up to
adulthood.
That is difficult. Dr. Misanga Dimitri, thank you very much for coming.
It's a pleasure for me to be here, and I'll be glad to respond positively for the invitation.
I like this kind of junior brothers. They make my life complete. Thank you very much, and thank you for coming along with our little daughter Ngo Kam Erna Osana. In the next few years, she'll be sitting with the person who will be presenting Family Health by then, and they'll be doing the program together. But for now, we are going to welcome Apala Zita. She has a fresh harvest of information across the world for us. Maps Zita. I'm trying to call her Facebook name. Maps Zita.
Good afternoon from Miss AKANTEH.
I don't know if she sound very well. I'll also make the how do you put P and Z at the same place? How you been a banso? Sorry, I said that on air.
You did. You
No,
did.
my microphone was cut off. Well, you're here for the 2 p.m.
Exactly. The 2 p.m. will be going back to last Saturday to get more vibes about Act 2 of the Maso. You know, it can never be overemphasized. It was lots of fun. It was an excellent moment. And this time around, we'll be talking with the president of the organizing committee to check out the how far. Is she satisfied with what she did? Is she satisfied with her mutualists? Her team in general? We'll get her speak. And then we'll be taking you to Ivory Coast, where the president is meeting with other presidents, ex-presidents, to see how they can hasten the process of national reconciliation in the country.
We don't have ex-presidents in Cameroon.
Unfortunately, we don't have ex-presidents
So
in
we can
Cameroon.
never have that kind of activity in Cameroon.
Yeah, such
Where?
talks will take time to hold in Cameroon.
Anyway, maybe our grandchildren will experience it.
And of course, we have sports too. The Indomitable Lionesses have to roar tonight. And,
against the Super Falcons.
Yes. For once, we are hoping that things will be different.
Hallelujah. Up next is the Royal Afternoon Edition, the 2 p.m. This is Mapa Lazita. Please move for muscle. A big thank you to Salomon Isana at the Audio Console, Alan Kwekam and Wilson Yuge at the camera for the live broadcast on Facebook. Carol Prudence, thank you for coordination. Bisa Emmanuel for general supervision. I was privileged to have Dr. Misanga Dimitri with us to discuss hypertension and diabetes in children. My name is Promise Akante, wishing you a royal